Degenerative disc disease is one of those conditions that perplexes a lot of patients. They don't really understand exactly what it is. And to be completely honest, you really need to actually see what you're talking about if someone's giving you that diagnosis. I would hope you've only been given that because you've had an MRI report, because that and some element of X-ray are the only real way in which you can diagnose these sorts of conditions. Now, the degenerative disc disease is kind of a continuum, and it's important for you as a patient to understand that continuum to a degree. Now, on the one extreme, we have severely degenerated discs, where this disc space is almost gone. Okay, there's more or less no space. It's pretty much bone on bone, and we don't really have any disc left. And then the other end of the spectrum is a mildly dehydrated disc. It'll show up on an MRI, for example, as not being quite as white indicating fluid content, and that'll flag up and may be commented on a report. So these two conditions affect essentially pathology that's affecting the disc. It's invariably compression, excessive compression over a long period of time that's causing the disc to fundamentally degenerate. And one thing that we find is it's often in pockets. It's very rare that someone will come in with profuse degenerative disc disease throughout the entirety of the spine. What we see, especially in cases where it hasn't been dealt with effectively, which is why patients come to our door, is that it's one or two segments, commonly the 4-5, 5S1. It might more frequently we're seeing 1-2 and T12 being affected. And these are where patients have been repeatedly over a long period of time compressing through those discs with forward bending motions. It'll be the slouch back in your office or sofa chair for long periods of time, or it'll be sat in the office on these discs, or standing with bad posture, or a reduction in the lumbar spine. All these things can put excessive pressure over the discs or on the discs for an extended period of time. And someone coming in with degenerative disc disease invariably has had a longer history of back pain. It's not been there for a short period of time. It might have started off as back discomfort and then progressed onto a bit more severe discomfort, and then it's become actual back pain in the lower back. And of course, remember throughout this can affect the neck in the same way. So what do we do about these sorts of degenerative disc diseases? We treat them as a disc injury, because that's what they are. They're not so severe as to be a bulge or a slip disc or a herniation. It's the general comment of the health of the disc in its entirety. Now, when we're treating these, we want to do a number of things. It's quite clear that the disc is injured because there's inflammation around there, because there's tissue damage. So we want to get those tissues to start healing more effectively by doing laser over this section and through into these discs. And that works very effectively and is very relieving. The next step is doing the IDD therapy, and that is spinal decompression. If we've got a compressed degenerate disc, because they don't get degenerate if you're stretching them on a daily basis, and that very rarely happens, okay, when they're compressed, we want to unload those discs so we can actually improve the space there. We want to take pressure off those discs and provide some respite. And the easiest way we kind of explain how this works to a patient is if you've got your kitchen sponge and it's full of soap. If you squeeze that sponge and you put it in the water in the kitchen and you take it back out again, it's still got soap in it. But if you take that sponge and you let go of it a little bit, you put it in the sink in the water and you start pumping it like that, you get that exchange of nutrients, you get that exchange of fluid in and out of the disc, in and out of the sponge, and that's where you get that hydration, that helpful beneficial tissue exchange or fluid exchange, and that can help improve the health or the overall health of the tissues in that region. So this is a really important point of note, and that's how the IDD therapy and the spinal decompression work, by affecting the pressure gradients in and out of these discs. So that's one fantastic part of treatment. The next thing you get is, if you have this sort of degenerate disc, you're going to note that there's a lot of muscle spasm in that area. There's muscle discomfort because you're in pain or discomfort all the time, and there's stiffness. And those muscles compressing down through this section here are going to further the degenerative process. It's not helpful. And often this is initially misdiagnosed as muscle spasm again, similar to the other disc injuries that we've mentioned in some of the other sections of our website and YouTube channel. So when we're treating these, we also want to address that muscle spasm. And finally, if it's a more progressed degenerative disc, we want to get a bit of movement through the other sections of the spine, so those sections are as mobile as possible, to give this little disc a bit of respite while it's trying to recover and trying to heal. And there will, without a shadow of a doubt, be some element of rehabilitation necessary outside of the clinic to really reinforce for the long term the treatment that's done, to make sure that you get more of a lasting effect from treatment, and that things really go through the appropriate healing process and your body's much better afterwards. So if you've got any more questions about your particular case of degenerative disc disease, then please do get in contact with us using any of the contact modalities on our website, and we'll be more than happy to help you.